It is 1983. It has been 2 years since the first cases of pneumocystis carinii pneumonia were reported to the Center for Disease Control. Since 1981, over 600 deaths have been reported. The CDC has only just named AIDS officially in September. Before that, it was known as GRID, Gay-Related Immune Deficiency. There has been no government response. President Ronald Reagan has not spoken on AIDS and will give one and only one speech in 1987 that addresses AIDS. He calls it Public Enemy Number One, establishes the President's Commission on the HIV epidemic, which was largely ineffective, and then will leave office in 1989 without doing anything else. In 1987, Congress will explicitly ban the use of federal funds for AIDS prevention and education campaigns that promote or encourage, directly or indirectly, homosexual activities, limiting any outreach efforts made by the federal government. The AIDS epidemic exposed and exacerbated the multiple fault lines of social and economic inequality and justice, revealing our political system's weak points. Because the disease was prevalent much more in such stigmatized groups, gay men and drug users in particular, and because the Reagan administration allowed only partial measures and inadequate funding for the CDC, there was no immediate action taken, which turned out to be fatal for hundreds of thousands of people. However, much has already been said about the lack of cohesive governmental response to the AIDS crisis. As a result of the government's passiveness and sometimes even blatant interference to the epidemic, the LGBT+ community drew together. Sometimes, depending on the organization, with other affected communities, sometimes without, the AIDS-positive LGBT+ community had to work out things for themselves and become their own doctors, researchers, and legislators. It is 1983, and the start of AIDS activism as we know it begins here, with the Denver Principles, a list of 17 principles drawn up by AIDS-positive activists outlining the demands of a community that has been devastated by the disease. Over a dozen people stormed the Second National AIDS Forum at the National Lesbian and Gay Health Conference in the June of 1983, demanding that instead of being talked about, the conference hear directly from the people actually affected and infected. It established the tone for AIDS activists for years to come, forceful, loud, determined in the face of a staggering amount of deaths, and fueled by the emotional turmoil of friends and loved ones dying around them with no tangible reaction from the government. Of course, the Denver Principles themselves were a powerful statement, but it just wasn't enough to mobilize institutions into revolutionizing the way they thought of patients, and AIDS patients in particular. Government indifference continued well into the 1980s despite the principles as said before, and the Denver Principles didn't even reach the ears of the public. When polled even as late as in 1986, about 50% of Americans consider it people's own fault if they get AIDS, and 54% thought that people with AIDS should be made to carry a card to this effect. Many were concerned and often misinformed about how AIDS was transmitted. 47% said they would avoid someone who tested positive. A headline by the New York Times in 1986 noted that for the last 3 years, anti-gay violence had been on the rise because of publicity surrounding the spread of AIDS. Cases in New York had doubled over the past year alone, and while the death of Rock Hudson, a famous Hollywood celebrity, raised awareness of AIDS and only added to the fear felt by the public, it did nothing to alleviate the homophobia surrounding the disease. There were several AIDS activist organizations that developed in the wake of the Denver Principles: the National Association of People with AIDS, the National AIDS Network, and the Federation of AIDS-related organizations, for example, but the most influential and noted by far was the group ACT UP, formed in 1987. It was incredibly effective in achieving its goals, though they faced considerable opposition in doing so. From the beginning, ACT UP has been the subject of domestic terrorism and civil unrest FBI investigations and have faced police brutality and legislative intimidation. The police brutality has ranged from verbal abuse to physical assault. The legislative intimidation entails the filing of multiple felony charges against activists in the group, the use of a grand jury to divide queer and AIDS activists, and the indictment of ACT UP members on felony charges for protest. They have also weathered a campaign of harassing phone calls and death threats and derision from mass media, who claim that they are irrational and extremist. Despite initial resistance, their nonviolent civil disobedience and direct action tactics yielded undeniable results.